Fred Hubbell, the Democratic candidate for governor, is still on his statewide mental health tour, and he made a stop in Mahaska County on September 17th.
I think the dominating fact is, as one of the individuals said here, is our state is not focused on the patient and trying to give the patient the medical care that they need or the quality of life, depending upon the nature of their issue. We're focused on just cost containment. And the right answer is we should be focused on outcomes. We all want somebody who's got a broken bone to get it fixed and get back to work. Well, you know, if the earlier you identify and recognize mental health or substance abuse and start to provide the treatment, oversight, supervision that they need, the faster they're going to be productive members of society too, and the less severe their mental health or substance abuse is going to become.
He spoke with local officials from Imagine the Possibilities about their concerns and thoughts with an emphasis on mental health and substance abuse. Todd Seifert, CEO of Imagine the Possibilities, said his piece.
We feel like we've navigated this pretty well, and we're not here to complain about everything that's happened. We'd like to be part of the solution going forward, but as Wendy always says, it's really frustrating when you never get paid what you do, you know, that kind of thing. And like I mentioned down in the Quad Cities, prior to managed care, we didn't have any money. Well, now you're taking 3% to 20% right off the top. That doesn't work when you have rates that are from 2014 to begin with. I mean, our health insurance, our work comp, everything goes up double digits, yet the revenue goes down every year, and we're expected to somehow make that work. We've taken the approach of being very efficient. I think the reason we've done well is we have very little overhead. We have about 4 people, basically, as an executive management team for a $35 million organization. I would argue that when we were an $8 million organization, we had more overhead then than we do now. And I think that's a positive outcome.
A press release from the Hubbell campaign said according to the Treatment Advocacy Center in 2016, Iowa ranks dead last in the number of psychiatric treatment beds available per capita, and 47th in the number of psychiatrists licensed to provide care.
Well, a lot of it, we have a psychiatry school down at the University of Iowa, but we don't have any program to incent them to go to work in Iowa. We have a program to incent general practitioner doctors to work in Iowa, but not psychiatrists. And what I want to do is I want to expand that program. So if a psychiatrist gets out of the University of Iowa psychiatry program and they want to go and they're willing to go to work in rural Iowa, commit to do that for 5 years, then the state and that local community that needs those people will partner together to pay off that debt in 5 years. You know, that's similar to the program that they have for the general practitioners.
While healthcare has been a primary aspect of Hubbell's campaign, he isn't worried about voters thinking he has a single focus.
Well, what I've been talking about all across our campaign is what we need to do is we need to produce a balanced budget with the right priorities for Iowans. And those priorities are basically what I get from Iowans. Iowans are very frustrated with the accessibility and affordability of healthcare in our state. They're very frustrated with the decline in education.
Elections are November 6th. For more information on Hubbell and his part in the gubernatorial race, go to fredhubbell.com. For Atoma Radio, I'm Erin Fraser.